Well, for 2 years now, people around the world have asked the question, when will this pandemic end? It seemed we were getting closer to that answer, and then the new Omicron variant arrived. Joining me now to talk more about when this might end is Dr. Amesh Adalja. He is a senior scholar at the Johns Hopkins Centre for Health Security. Joins me from Butler, Pennsylvania. Dr. Adalja, good to see you. You recently talked about the pandemic entering the endgame stage. What does that actually look like?
What it means is that we will still continue to see cases, but those cases will increasingly be decoupled from hospitalizations and deaths as we have more tools like antivirals, monoclonal antibodies, rapid diagnostic tests, and more immunity in the population from vaccination as well as from prior infection, especially with the Omicron variant. So what we will have is a more manageable respiratory virus, one that looks more like other respiratory viruses we deal with year in and year out, but it's not going to be like 2019. It's still going to be a time when we have a baseline number of COVID cases, hospitalizations, and even deaths, but they will be much easier to handle than they are in certain parts of the country right now.
When do you think that will happen?
We're starting to see that decoupling in some U.S. states based on their vaccination status, but not all states. So I think as we get further into 2022, after we get through this Omicron surge, after we get more availability of rapid tests and more availability of the Pfizer antiviral Paxlovid, I think we will be there. So hopefully by the end of the first half of 2022, we will have transitioned. And I think you're already seeing that in the rhetoric from the president, from the cabinet, talking about the fact that if cases are mild, we don't really focus so much on severity. This is all about hospital capacity.
Is it fair to say the U.S. has been seemingly more willing to accept deaths? We're talking 800,000 Americans have died from COVID-19 when the flu typically kills between 12,000 and 52,000 a year. Why has there seemingly been an acceptance in certain states that the mortality rate is high and lockdowns aren't necessary?
Right now, in this country, the majority of deaths are occurring because people are choosing not to be vaccinated. And I think we, as Americans, kind of have gotten onto this two-track pandemic where the deaths that are occurring are in the unvaccinated, whereas the vaccinated can kind of go about their life free from the risk of having severe disease, hospitalization, and death. And that's sort of become something that we as a country have accepted, that people are choosing to do this. What's the bad part of that is in the process of choosing to do that, they're crushing community hospitals where people need to go for care for other diseases. But certainly right now, it's not acceptable that we have that many deaths, but these deaths are almost self-inflicted because people are choosing not to be vaccinated. And that's a very different problem than in the early days of the pandemic when people didn't have vaccines, when we were trying to get people to make good risk calculations. But in the end, lockdowns, I don't think necessarily were ever the justification here. That's what you do when you have policy failure. And the reason why the U.S. had these lockdown policies in some of the states was because the federal government failed in January, February, and most of March of 2020 to get testing up to scale, to get personal protective equipment, to get hospitals ready. We failed, and that's why we had these types of measures. They should not be what you use to control a pandemic. What we need are precision-guided tools. And in the era of the vaccine, I don't think there's any place for those blunt tools like lockdowns.
As Ontario, the province where we are, enters a 21-day lockdown of sorts. Dr. Adalja, I wish we had more time, but I appreciate yours today. Just quickly, do you foresee further mutations?
This virus is always going to mutate. There are always going to be new variants, but it's going to be very difficult for a variant to get around all the protection that a vaccine provides us, especially protection against what matters: serious disease, hospitalization, and death.
Dr. Amesh Adalja, thank you again. Appreciate it.
Thanks.